Hello, I'm Lena and I'm an accredited practicing dietitian. Today I will be talking about eating disorders, how to screen and flag people displaying disordered eating behaviours, and what a dietitian can do to help support and treat someone with a suspected or diagnosed eating disorder. Eating disorders refer to a group of mental health illnesses, and it is estimated to affect 5% of the Australian population, with this number increasing. These illnesses are manifested by a broad spectrum of symptoms, ranging from disordered eating patterns to eating disorders that meet full diagnostic criteria, or the DSM-5. They are serious and potentially life-threatening, with significant nutritional, physical, and psychiatric consequences and complications. Eating disorders affect males, females, all genders, all ages, and all cultural and socio-economic groups. According to national surveys, body image concerns and dieting rank amongst the top concerns in adolescents in Australia. Therefore, eating disorders are highly common and should be recognised as a significant mental health and public health issue. Eating disorders are characterised by changes in behaviour, thoughts and attitudes to food, eating, weight or body shape, and all have a detrimental impact and can wholly interfere with one's life physically, emotionally, occupationally, and socially. There is no single pathway to recovery from an eating disorder. Recovery can expand over many years or just a few, and recovery looks different from person to person. Although recovery periods can be protracted and extensive, with the right treatment and support, a full recovery from an eating disorder is possible. Dieting is the single biggest predictor of the onset of an eating disorder. It can be considered to be a risk-taking behaviour, particularly where it occurs in the gender and age groups most at risk for eating disorders. The presence of an eating disorder should be considered when altered eating behaviours become clinically significant and interferes with normal functions in areas such as physical parameters, psychological well-being, social functioning, or occupation. So what can a dietitian do? Dietitians understand how your body works and how nutrition plays an important part in well-being and recovery from an eating disorder. They will work collaboratively with you, other members of the health team, to develop knowledge, strategies, and skills around food, eating, and nutrition. A non-diet approach is, as the name describes, an approach that discourages dieting. It teaches people to eat intuitively and develop a healthy relationship with food by looking at all foods equally rather than certain foods being good or bad. This also helps to encourage flexible eating and feeling more relaxed around food, which is important for recovery. One of the great aspects of this approach is that it encourages self-compassion and kindness to ourselves, which is incredibly important in the recovery process. Principles of the non-diet approach will be incorporated throughout the appointments. However, certain steps such as ensuring nutritional adequacy may need to come first before exploring intuitive eating. So the purpose of the nutritional assessment is to gather sufficient information to inform treatment planning, practical goal setting, priorities for education, and strategies for behavioural change. The aim is to obtain an in-depth understanding of the person and their relationship with food, eating, and body weight, and also to begin the process of developing a therapeutic alliance. The nutrition assessment will provide more detail than the medical assessment around BMI, weight history, abnormal eating behaviours, attitude to weight loss or gain, and exercise pathology. It will also include a detailed assessment of dietary intake, compensatory behaviours, biochemistry, anthropometry, family food or exercise beliefs, and it will also provide information about nutritional status and identify associations between emotional eating and food. It can also be informative to collect the following information: so a diet history and time course of beliefs around food, current nutrition intake, food and taste preferences, food allergies and intolerances, self-diagnosed or medically diagnosed, food rules and feared foods, food rituals such as measuring, weighing, or calorie counting, hunger, fullness, and satiety cues, as well as mealtime environments such as who prepares and cooks, who goes grocery shopping, eating environment, and behaviours. Recovery is never a straight trajectory forward, but instead involves many ups and downs, lapses, and even relapses. It is definitely possible to recover from an eating disorder. Even people who have been living with an eating disorder for many years can get better. The path to recovery can be long and challenging, but with support and from the right team of professionals and with a high level of commitment, recovery is certainly possible. Identifying people at risk of developing an eating disorder or exhibiting symptoms suggestive of an emerging eating disorder are the responsibilities of all health professionals. Early case detection and provision of treatment may be more beneficial than prevention programs. If you would like any further information on how an empowered dietitian can help, please call 1300 043 578 or make an online referral using the referral form at empowerhealthcare.com.au. Thank you.